Welcome to our webinar, Sharing Learning from the Starting Well Fund and Barnardo's Consortium. I'm Celeste, the Maternity Consortium Coordinator and Engagement Lead at the Sans and Tommy's Policy Unit, and Abby is my co-host today. So would you like to introduce yourself?
Hi everyone, we're delighted to be invited to co-host today's session. My name's Abby Knight. I'm here to represent Barnardo's Consortium, and I'm our strategic lead for integrated child and family health.
Thanks, Abby. And please do all introduce yourselves in the chat. I can't currently see the chat because I'm sharing my screen, but once I stop, I'll be able to see everyone who's here. And it's nice to kind of make connections in the chat. So please do that while we kind of get started on our introduction. So I'm just going to give a bit of background to explain why we're here today, who we are learning from, and why we're co-hosting with the lovely Barnardo's, and that will kind of involve an overview of the work that we both do on the Health and Wellbeing Alliance and the Maternity Consortium, Barnardo's Consortium, and the Starting Well Fund. So, oops. There we go. Okay, so the Health and Wellbeing Alliance is a partnership between the voluntary sector, the Department of Health and Social Care, and NHS England, and it includes a number of partnerships and consortiums focused on a range of different health and social care issues. And Tommy's and Sans are leading a maternity consortium, which includes National Maternity Voices, the Pregnancy and Baby Charities Network, and a number of community organisations, including 5 Times More, the Muslim Women's Network, and LGBT Mummies. And the Health and Wellbeing Alliance kind of has 3 key aims around promoting equality and reducing health inequalities, facilitating partnership working between the voluntary and statutory sectors, and facilitating kind of collaboration and co-production, ensuring that service user voice is brought into national policy development and delivery. And as part of this, the Maternity Consortium delivers a range of projects each financial year related to these aims around preconception up to the first year of a child's life. As part of this, we have a project which supports the Starting Well Fund to share learning across the system. And the Starting Well Fund is part of the Health and Wellbeing Fund, which is essentially the other arm of the Health and Wellbeing Alliance. So this has an overarching aim to promote equalities and reduce health inequalities. And each year, the funding focuses on a specific theme. So a few years ago, the Starting Well Fund was the theme, and it's around reducing health disparities among new mothers and babies. And as I said, as part of our work on the Alliance, we support learning being shared from this fund. So I'll just hand over to Barnardo's, who are our co-hosts. They are also on the Health and Wellbeing Alliance, and we are working together on this webinar because a lot of the projects that the Starting Well Fund and the Maternity Consortium and the Barnardo's Consortium cross over. So we thought it would be nice to deliver this webinar collaboratively. So I'll just hand over to Abby, who will give a bit of an overview.
Great, thank you very much. So I'm here today on behalf. Oh, I've got some echo. I don't know if anyone's got their microphones on. If you could turn them off. So I'm Abby Knight. I'm here representing Barnardo's Consortium. We're a consortium of 14 grassroots organisations, all of whom work with children and young people. And it's been a real pleasure being part of the Health and Wellbeing Alliance, partly because when we're working with our policy colleagues within NHS England and Department for Health and Social Care, we often find that a lot of health policy is focused on adults or starts with adults with the intention of coming along to children and young people, whereas it's been really powerful to be able to kind of amplify the voices of our consortium around what that means in practice for initiatives that may not be initially designed with children and young people in mind. So it's been really, really important there. And I think, secondly, but certainly not secondly in importance, working with Health and Wellbeing Alliance members, such as the Maternity Alliance, has been incredibly helpful in understanding the different perspectives and the range of work going on. So when within Barnardo's, one of our priority areas for health is in prevention and early intervention. And we know that that the development antenatally, gestationally and post-birth is so important. So it's such an important part of the pathway that we're developing that we'll be talking about today. And we're delighted to be able to introduce a member of our consortium to speak on one of their programmes today as well.
Thank you, Abby. So the agenda was on the Eventbrite, so I won't run through it now, but we've got 4 great presentations for you today. As I said, sharing learning from the Starting Well Fund and from the Barnardo's Consortium. And each presentation will have a short Q&A following it. So do have a think as our presenters are speaking, what questions you might like to ask. If you pop those in the chat, then we can collate them during the Q&A session. And then if there's time, we might be able to invite people to come off mute and ask their questions in addition to the ones in the chat. General housekeeping, we've said it a couple of times, but if you wouldn't mind just keeping your microphones on mute unless you're presenting. The webinar is being recorded and it will be shared shortly after the webinar ends, and the slides will be circulated as well. So with all that in mind, I am very pleased that Abby is going to kick us off with our first presentation on developing the Universal Language Programme. Thank you.
Thank you very much. I shall just pull up our slides. Do let me know.
See you later. Take care.
When that's come up.
Yeah, we can see that. Thanks.
Lovely. Thank you. So I'm here today with a number of colleagues that we've been working with across a partnership to develop a programme of work around addressing maternal health inequalities and infant parent mental health support. What I'll do as we're presenting today, I'll ask colleagues to introduce themselves as we come to their section, if that's all right, and I'll hand over to you at those points. But as I said when I introduced myself and our consortium, one of the most important parts in the pathway that we recognise is the support that we can offer to mothers, birthing people and close families in that antenatal and postnatal period, and recognising that people's experience of that period isn't equal. We see you'll be very aware of the stark maternal health inequalities that are experienced, and so through our local work we've formed a strategic partnership across 3 organisations in Peterborough, in which we intend to be co-producing an anti-racist, trauma-informed and rights-based approach to antenatal and postnatal support. So we'll talk through what that looks like to you shortly. Working within Peterborough, we've developed a strategic partnership between 3 organisations where we're each bringing our own strengths and assets to the table. So Barnardo's, we run the Child and Family Centres within Peterborough and a range of other support services. The Raham Project is a local organisation led by Pfizer, who's a midwife herself by training, and works with local communities to address health inequalities experienced. And Mind CPSL is a branch of Mind within the local area that's been doing some particular work around perinatal mental health, and in fact that's the start of this journey in some of the Starting Well programmes that CPSL Mind were involved in. And what we're developing locally is almost testing a brokerage relationship, so recognising that an organisation like Barnardo's, being a national organisation, has that strength of infrastructure and support and the ability to create an enabling environment, but actually others may be better placed to establish and maintain those trusting relationships with local communities. So it's that kind of brokerage model and template that we're looking to develop, and with a view to addressing those health inequalities. So, as I mentioned, this started with CPSL Mind and a piece of work that was undertaken over the last couple of years. And I'll hand over to our colleague Emily to introduce herself and talk through that programme a little.
Thanks, Abby. So hi, everyone. I'm Emily Gray. I'm the Deputy Chief Exec of CPSL Mind. That's Cambridgeshire, Peterborough and South Lincolnshire Mind. And yes, we've been funded for the last 2 years, 3 months or so through Starting Well funding. We actually have the Starting Well funders here today doing a visit on our project, which is fantastic. And we've received some funding to essentially redesign our existing perinatal services to make them accessible and appropriate for Muslim women locally. So we have been running perinatal services since 2013, very well established, highly regarded community mental health services. But what we were finding that those services weren't being accessed by our local Muslim communities and our local Muslim mums. At the time that we put in the bid, we'd worked with over 500 women in Peterborough, 500 mums, and 7 of those mums had identified as being from a Muslim community. And we knew that wasn't good enough. It wasn't representative of our community. In Peterborough especially, we have a large Muslim community. Around the last census 12 years or so ago, there was about 10% of the population in Peterborough identified as being from a Muslim community. And that wasn't represented in our statistics. So we received funding to do a huge piece of service design. We used a service design toolkit. We engaged 8 peer designers from the Muslim community with experience of challenges in perinatal mental health, or not, as the case may be. Really, really representative group of women from different backgrounds, different experiences, different languages spoken. Some had grown up in this country, some had moved here as an adult, some had moved here as a child, some had 1 child, some had 10 children. So a really vast range of experiences to conduct ethnographic research with members of their community, and again from as a diverse amount of individuals and people and experiences as possible. Those 8 peer designers conducted 24 ethnographic interviews and attended 5 co-design sessions to pull together those insights and themes and learnings from that vast amount of research. And as a result, we developed an insight report, which is available. We can share. We'd love to share it with the group if it's of interest. We have an email version and printed copies. And the insights came down to these 3 themes that you can see here. So I won't go through them one by one, but the themes that we found through the research were that women in Muslim communities, in this case, had issues with loneliness and social isolation. Time for self-care wasn't recognised as something that is important for mums and for families, and still a huge amount of stigma and lack of awareness, and some of that was self-stigma. So, and then lots and lots of sub-themes around that, and we use those insights to ask some how might we address some of these challenges, barriers, and how might we redesign our existing services to ensure that they are representative of Muslim women, including Islamic content, culturally appropriate language, and this huge piece of service design. So that's a very quick whistle-stop tour, and I will stop talking there, Abby.
Thanks very much, Emily. There's so much to say, and the Insights report is certainly worth a read for those who are interested. And looking at that Insights report, what was very apparent is that if we're looking to address perinatal mental health issues, we need to start with women and birthing people's experience of support during the antenatal and postnatal period. And that's what brought us to the Raham project. And I'll hand over to Faiza to introduce herself.
Hi, everyone. Thank you for having me here. And it's so lovely to be here with our partners, who I'm going to say are absolutely awesome. So Raham Project is a grassroots organisation that was founded by myself. I'm a local mum. I've grown up around Peterborough, know the diverse communities very well. And I guess how the community functions is in my blood. I was raised with it. I knew what they needed, how they function, how to get into them. As I matured, I decided I wanted to become a midwife, and I ended up qualifying in Sheffield, and I've been practicing for the last 13 years. And it's actually my experiences as a midwife that made me realise something's happening in the diverse communities in healthcare settings where I feel like they need more support. And the type of support wasn't necessarily clinical support, it was more that holistic support, ensuring that we're recognising their holistic needs, their psychological needs, their emotional needs. So I'd have a lot of people who I had to care for in my clinical practice who often identified with me and would share things with me that I noticed that they wouldn't share with other practitioners that I worked with. Over a period of time, I started to think I need to start collecting their insight, why they're feeling, how they're feeling, what are they feeling, collecting it and feeding it back to our healthcare system. And in doing that, Raham Project was essentially created. But as Raham has developed for us, we're a small grassroots organisation, I've realised that health organisations alone cannot fix all the problems that our communities face. I really, really strongly believe that we need to come together with other local organisations and assets that have loads of valuable resources to come up with joint solutions for our communities. Hence why I ended up connecting with the organisations that I have. I truly believe that they've got the right value, the right ethics, our visions align. And I believe people in my community are going to be safer for having people with a similar vision in place to create that for them. So Raham Project has jumped on this really amazing adventure in growing ourselves as a small organisation, but also learning from other bigger organisations of the voluntary sector. And I guess we bring to the project our experiences, and we bring some really kind of well-established trusting links with the community, and those take time to nurture. And I guess that's something really key that we're able to bring to the project. So thank you for listening, and I'm excited to hear the rest of it.
Thanks so much, Faiza. And then last but not least, I'd like to introduce you all to Kat, who's the person responsible for bringing our partnership together, and who very much embodies that enabling environment that we're seeking to create. Kat.
Oh, thank you, Abby. I feel a little bit emotional actually just hearing some of this, because it feels like this has taken a lot of, I think, personal sort of labour from everyone involved, and it's a real sort of show of commitment around the strength of feeling that things that are happening in this space are not okay, and things have started to improve, but they're still not good enough. I'm Kat. I'm an assistant director for Barnardo's, and the services that I oversee are in Peterborough and Cambridgeshire. I've worked with Emily and her team from CPSL Mind for quite some time now, and a newer relationship is with Faiza and her team, but that's one that's grown over the past sort of 18 months or so. Just the stars aligned, we had a conversation, and as often things do, from conversation grows these sort of ideas and seeds of opportunities that we've been able to collaborate on. And I think one of the biggest things that myself and Abby wanted to try and achieve on behalf of Barnardo's is that we were an enabler, that I think that we have a duty as a larger organisation as well to support those who are best placed, and I know you said this, Abby, but I want to reinforce this, who are best placed to work directly with communities, who know their communities, who are already engaged. It's not for us to get in the way of that, it's for us to support and provide that generous sort of leadership and support in the back, if you like. But we do, as part of our services, we run the child and family centres across Peterborough and South Fenland, and that gives us quite a unique opportunity as part of the universal language to work directly with communities in spaces that they're comfortable with. The ethos behind the child and family centres that we run is very much about leaving no one behind, and I mean no one. And sometimes that means that we do have to run services in a slightly different way, targeted at particular communities, although the end goal is that at some point in our lifetime, everyone will be able to access the same suite of services and it's inclusive, etc. So the role of our family hubs in this, and we are converting into family hubs, is specifically around supporting with from conception, and I'm very deliberate in my sort of positioning of that, conception all the way through to say roughly around 2 years. In line with CPSL Mind's view of this, we do include up to the age of 2 years in the perinatal period. We already run some joint partnership work with CPSL Mind as part of our centres. We are tasked as part of our specification to deliver perinatal provision universally. But as Emily was saying, we know and we knew that we are not doing enough. We are not reaching those who most need this support. And actually, what we know from those insights that Mind have generously shared is that this isn't really that complicated. It is based on developing the trust, because there is so much mistrust of institutions that, you know, that is the first stumbling block. But it's also about that relational working with families. So the point that we're at is massively exciting in that we have the aspiration to not only do this in terms of developing from the ground up with families, hearing their voices, centering everything that they are saying, but also working in a system level where what we do is we're setting up programs that are rights-based, choice-based, and then when they families get to that point where they need to use those services, either for appointments or actually giving birth, that they're not rebuffed and told, well, I don't know who's told you that, but that's not what's happening here. So we're taking this from a pincer movement. We are, in terms of ambition, wanting to change things systemically, not just locally, but nationally. And let's be clear, you know, there is this notion of systemic racism. That is real, that is happening. And we need to be brave in our language that we are using in saying, we want to work hand in hand with teams to address this. We don't want to beat people over the head with a stick. We want to take you with us. We want to work hand in hand with you. And we are going to have some brave conversations and unlearn some of those really unhelpful things that have been embedded in us, you know, from knee high. So I think I've talked enough, Abby, but I just, you know, I'm so delighted to be part of this and just so excited to see where we can take it.
Thanks very much, Kat. And I think the point that Kat's making around the relational support is so fundamental here. And by embedding this programme within child and family centres, it allows us to establish those trusting relationships and see if we can improve access to a range of services, kind of lifelong for children and families as well. So that's part of what we're testing through this. I'll very quickly, as you can tell, there's a huge amount in this programme, so I'll very quickly talk us through it so that we've got time for some questions at the end. But by coming together, we really wanted to share today some of the legacy of that initial Starting Well funding that CPSL Mind received, that we're taking it forward to look at establishing a maternity hub within Peterborough, where we're putting women and birthing people at the centre and then directly employing peer designers, so people with lived experience, to be co-producing support services in the truest sense of the word co-production. So these are permanent posts. These are looking at how we can harness experience and take the strengths from that to design services that respond to what people are asking for. And through that maternity hub, we have, you can kind of see as we go out in these circles, that lighter blue there are the possibilities of what will be offered through the maternity hub. But we don't want to be second guessing this. So we are at that stage now where we're recruiting to those peer design positions in order to co-produce this and be led by by the communities we're reaching. And then this wider circle, this white circle at the outside, are a number of the wider systems services that we want to be working alongside and supporting, so that in future we wouldn't necessarily need a programme like the one we're describing today. And I think, you know, speaking from the health team's perspective, one of the areas where we're particularly interested in, so we have some really fantastic conditions for success within Peterborough to establish these relationships. And from the health team, we're really looking at, well, what are the factors where we can reproduce this way of working, and how do we test that brokerage model and enabling environment elsewhere to do the same? And then just finally, an additional piece of work that we're looking at around this, recognising that through the creation of the maternity hub, we know that when people feel supported, feel held, it's at a point where emotional support needs, mental health issues may arise that they want to have addressed. The demand far outstrips supply at the moment, as I'm sure we're all aware of. So one of the things that we're testing at the moment, and we're running some insight sessions locally, is to develop a remote access parental wellbeing support programme, which would allow us to use some of our national assets that we hold within Barnardo, such as our virtual family hub, our Bolo helpline, which speaks a range of community languages, but to provide perinatal support in a way that still feels local. And that's something that we're developing and testing at the moment. So I'll stop there. Celeste, I've done a terrible job of keeping to the time, but I don't know if we have a few minutes to take any questions.
I think we might be able to squeeze some in. So we don't have any in the chat currently, but I'll let people have a minute to have a think. If anyone wants to raise their hand and ask their question off mute, that would also be welcome. So we've got a question from Nicola. Can condition-specific programmes feed into this wider project?
Is that looks like it might be a question for you, Kat?
I'm just sorry, I was just eating some nuts, so I was caught off guard. Apologies for that. Yeah, I mean, it would be really, Nicola, I don't know whether you can give a little bit more context. Are you thinking national projects that are already set up and how they might be able to link in if we look to mobilise this type of model elsewhere? Is that what you were thinking?
Yes, can you hear me? Exactly that. I work for Shine. We support children, families, parents with spina bifida and hydrocephalus. We just happen to be based in Peterborough, but I cover England. So we've done some research into the trauma the diagnosis presents parents to be from conception when they're diagnosed, the 20-week scan. We've got all that research. We've got a whole proactive support programme for families that have this diagnosis, and we'd love to be able to feed into something like this. We're trying to find avenues in, and the landscape's got a lot more complicated recently with ICSs. Absolutely. So I'd love a database of family hubs, but there isn't one. It's a case of contacting each one individually, I think, at the moment. But I'd love to better feed what we've got, and we're doing some e-learning about the conditions, which is free. I can send it to you to then send out to the group, and happy to take direct referrals if you come across people with these conditions, and we can support in that way. So it's signposting as much as anything.
Nicola, it's great to make this connection, because I think you and I would be best placed to have a sort of coffee chat outside the meeting, because I can also talk to you about the different arms. So the family hubs, which we oversee, I can talk you through all of that, and we can look at the pathways for us. So I don't know if you want to take my email address and just drop me a line and we can set something up. That's a great connection to have.
Thank you.
No worries. Thank you for getting in touch. I'm just reading something from Kim now.
Amazing. That was a perfect example of why we run these events. So connections can be made just like that. Let's just see.
Yeah, there's one about a measurement tool.
Yes. Any thoughts about what a good patient-reported experience measure might be to understand women and birthing people's experience of maternity care? Do you think it's possible to find just one catch-all measure?
I have my view, but I might invite Abby and then my other colleagues, because I think we all have our own experience of this myriad of tools that are out there at the moment. Abby, do you want to comment on this part?
Yeah, I mean, I don't have a silver bullet answer, unfortunately. I agree. It's very difficult to capture all elements. It's something we're looking at as part of this programme, and within it, we are commissioning an evaluation with some support from specialists in the field of health inequalities, where I would hope at the end of that I'd be able to give you a much clearer answer to your question. But yeah, I couldn't give you one off the bat. But I don't know, Pfizer, Kat, Emily, if you had any initial thoughts.
I'll let my other colleagues go first and then I'll wrap it up.
I just want to say that I was raised in the institution of using family friend surveys in a hospital to try and collect people's feedback. And my experience of them have been that often they're not very representative of diverse communities. And I think one of the key learning points for us has been, if we really want to get that rich insight, we need to be willing to put people in place to connect with the communities, to gather the insight. And then I think the onus needs to fall on the organisations to evaluate that and present that. I don't think our communities are always going to access things in a very kind of linear way. So I think the opportunity of having different ways of collecting data is important, but I definitely think with the diverse communities, having someone to connect with is very important to gather the data.
Emily, anything from you?
Yes, I agree. In our experiences with perinatal mental health, which is just a small part of maternity care, and even in perinatal mental health, we use numerous different outcome frameworks and measurements, depending on what the funder wants and what we're trying to achieve. So we use, clinical tools like PHQ-9s and GAD-7s, alongside more holistic tools like Recovery Star, which we find is the most popular one for our connecting mums, because it looks at your whole life. And that holistic approach. But I think, yes, the short answer is possibly, is it possible, as you say, to find just one catch-all measure? It's a very good question, and hopefully Abby's research will shed some light. But Kat, what are your thoughts?
Well, interestingly, this is one of the key areas that have come out of Donna Ockerden's recommendations nationally. So many of your local trusts will have a sort of action plan, if you like, in relation to maternity specific services. And what you might see is that one of those is particularly around ensuring that the maternity experience of all families is a positive one. Now, so I suppose what I'm saying to you is there is an aspiration, even outside of this project, to capture that, and what we would be best placed doing, and we are already doing, because we are linked to our LMNS and we are being sort of sponsored, if you like, by our local ICB and ICS. So we are integrated into those systems. Is to work collaboratively to say, well, what does that look like? And how can you possibly capture that for such a diverse range of individuals who will be utilising those public services? So I think it's an excellent question. It would be great for us to be able to come back at a later date and say, this is where we've been able to get to. And maybe that is something that could then be utilised elsewhere. But right now, there is no magic sort of bullet for it. And I think that's, I think that from asking the question itself, but I think that's the desired route, and there's a recognition that that should be the experience that all have who use those maternity services.
It's a great question. Thank you. Shall I move us on to the next presentation, Jessica? Yeah, great.
Yes,
Thank you
definitely.
so much to our colleagues for joining for that session. Really appreciate it, and thanks everyone for your fantastic questions. I'm delighted to hand over now to one of our consortium members, a fantastic organisation, the Women's Inclusive Team, which is based in East London. And we have Safia joining us today to talk about health inequity post-COVID. Safia.
I'm so happy to be here with everyone, and in fact I've decided to move to Peterborough by the amazing work that they're doing, and it's so positive to hear that, and I think we need to constantly share I guess what we're doing and making sure that we're learning from each other. I don't know, I've been trying to look at, let me see if I can share my PowerPoint. Let me know if you can see it. No. Are you able to see that? No. Let me do that again. I'm not a Teams person, I am a Zoom and Google. Let me see. Are you able to see my whole screen?
We can see, yeah, we can see your whole screen at the moment. There we go, we can see it.
Oh, fab.
Great.
And so Women's Inclusive Team is a Black-led charity that's been established for this year, for 20 years. Gosh, it's been a long time. And I guess that's our vision. And I think it's really important for us to kind of share the background of the work that we do. In terms of, as an organisation, we're quite lucky to have two centres. One is Mayfield Wellbeing Hub, and the other one is Chicksand Preschool, which is different services that we run. Sorry, bear with me one tick. Sorry, the background noise is gone, hopefully now. So we provide a number of services, and for us it's always constantly remembering who we are, who we're representing, who we are the voice to, and as a result we develop projects and services based on that. So developing potential, which is about developing women and supporting women, whatever that looks like for them. Community Connector is a 5-year contract with ELFT and looking at mental health and specifically sort of focusing on the Somali community but open to all communities, and we're quite lucky to have colleagues that speak 4 different languages between themselves. Advice and guidance is a huge one, people coming with different issues, and that actually enables us to then identify patterns or issues that then allow us to develop services and projects. Flourishing Community is a key one that's funded for 3 years now. It started off with a pilot project last year, and that sort of looked at GP access to, I guess, the Somali community specifically. And this year we're building on to support the Bangladeshi community, because the borough that we live in, the largest ethnic minority is the Bangladeshi community, but the second largest is the Somali community, and that's in Tower Hamlets. And then community kitchen and food inequality schemes that we run. And Chicksand, which is an Ofsted registered provision, looks at, I guess, early years and support for young kids and their family, and mother and toddler session, you know, bringing external people to come and equip our parents with skill and knowledge, but also providing free childcare for parents who want to go back into learning or employment and developing. And our youth project, which targets Somali young girls, because that was identified as a gap in terms of people accessing services. And Rise and Shine, that started off with our relationship with Barnardo's and has evolved so much into, I guess, not only the youth project, but still now making sure that young people's voice with the support of Barnardo's is heard, and that we document that and feed that back in, and obviously schemes and stuff that we run. So I guess from us being who we are and what we provide, I was asked to share with you, I guess, some of the maternity stuff that we've done, or patterns that we've identified. And we're quite lucky to have a partnership with Bart's, which is the local hospital that provides maternity support. And so there was a number of different things looking at what the impact of the women that have experienced. And I guess some of the recommendations we'll be looking at. But what's really key to know that actually the experience that these women in Tower Hamlets, East London experience will be the same that they will experience in other boroughs, because there is no border and it's not hospital based. It's about making sure that we understand the challenges and constantly remind ourselves, what else can we do better? And so I guess when we asked the women, and there was lots of discussions at this around maternity, you know, what are the issues? There's cultural nuances, and it's really important to understand that there's things that's embedded in them that are culturally muster to be a nagnol, which is a Somali saying, which would be a strong Somali woman, you know, screaming, for example, not having your husband there. And I guess ultimately, normally it's mothers that help their daughters in this very traumatic time, first experience of giving birth. And I guess their mothers don't speak the language, don't understand the system. So they're very much trying to hold on to the cultural nuances of what they've been embedded with, and also the lack of support because mum doesn't understand the language or mum is not in the country. And also what we identified when listening to women and what women have said is actually sometimes the experience of other Black midwives was also challenging because they didn't know. So we think it's only the non-ethnic minorities that might not understand the needs of, I guess, the Somali community or the ethnic minorities' needs, but also because we come with our own lived experience, and it's really important to understand what window of the world, that we all have our own window of the world. And so there was a number of women that we asked, and I guess the question here, we only wanted 10 women, but before we closed the slide, the link, we had 18 women, which was fantastic because it enabled us to really see patterns more clearly. And I guess for us, you know, enabling them to understand, you know, when we talk about trust, what does that look like for you? And I guess the local hospital at that point, Royal London. And so I guess some of the feedback was from there, but actually a huge chunk of them said, I guess, you know, when they look at their experience, you know, that they felt trust was an issue, was a clear one. And if we look at the bottom right chart, it enables you to understand the age group of people that we were speaking to. And I think that's really important as well, because it shows you that actually, regardless of their age, you know, they've been here for a long time or not, that actually there's barriers and challenges because we still carry those nuances with us. And I guess also what's sad to hear is 83% of those women said that, you know, they're positive, they didn't have a positive experience. And that's ultimately what we're talking about, is why are these women not having a positive experience? What is negating them from having those experiences? And I know that we're looking at the Somali community, but actually these are experiences that I'm sure other communities have. But for us, it was quite unique because the Somali community is the second largest ethnic minority, the largest Black community. And there were clear issues and challenges that those women expressed. And I guess the lived experience that we wanted to share was, and again, it's also interesting, the women that are very articulate, and this woman is very articulate, able to speak the language, and it's really good because obviously she has the cultural element, but she's able to articulate herself as well. And she had health issues, you know, and she gave her story there, and I'll allow colleagues to kind of skim read through that. But ultimately for her, she felt that she wasn't able to, and this came back in so many scenarios where women felt that they weren't able to articulate their concerns, their needs, their experience then, you know, in that present moment. And actually, as a mother of 5 myself, I felt very much, even though that I am articulate, there were many times in my experience of giving birth where I had to be very careful how I shared or told someone that I wasn't happy about someone, fear of being treated differently or worse. And that belief comes from, I guess, as an oral society and the Somali community, you know, talking, that you hear stories of actually be careful how you say things because then you get a negative treatment. And so being very vulnerable, for every woman who's very vulnerable in that position, you've got to be mindful and cautious of what that you said. But obviously for Naima, she's had a number of, I guess, health issues, had children before, but the impact that had, and even though that she, and the sad thing is obviously her husband actually was with her in this scenario, you know, she wasn't able to articulate her needs and her concern. And that's really important. And I think for me, when we talk about recommendations of how do we move forward as a community, how do we, remember we run the GP project and looking at inequalities, how do we improve services, the BARTS trust generally, how do we, within schools, there's racism and inequalities that we deal with schools. And for me, in every scenario when we talk about representation and we talk about improving services, actually representation is really key to that. Having people from those community, because by default, you're then having those expertise and knowledge with you that enables you to real time respond to the community, to report your colleagues to be able to to those communities. But also at the same time, if we're unable to get representation because they come with those lived experience and those understanding culturally, to then make sure that colleagues from different communities have the knowledge, the skills and the understanding, that we train them so they're able to be, I guess, you don't have to be from the community to show mercy and kind and respond to the needs of the community. So how do we make sure that we support that? How do we make sure that materials and literature and so on, how do we make sure that when staff start that they're told about the community and the needs and the barriers, so they're already building up on knowledge from past experiences that the community and colleagues have had? How do we make sure that departments pledge to that, and that there's goals? And I always say the right hand and the left hand must know what they're doing. So sometimes I go into boards and I talk to them, but how do we make sure that the board are filtering information back? So how do we make sure that each department is committed to making a change? And actually that goes further than that. It's an individual pledge that needs to happen as well, where an individual decides to be the best midwife, the best service provider, and that really comes from that person understanding the barriers that were before them and the impact that that has on an individual. Making sure that actually we've learned so much from COVID and Black Lives Matter in terms of a community as a nation. And I think there is key lessons that if we're talking about trust and lack of knowledge, that actually that we deliver services within community centres from those communities, because automatically by default you have the knowledge and you have the understanding and you have the trust that's already there. And we've actually started sessions where midwives come into our community centre twice a month, every fortnight, and that enables people that have, like Nim'a, and that's how we catch Naima's case study, that allows people to then have access to, I guess, specialist midwives, and then that those midwives can feed back those experiences that, again, we're doing real time instead of waiting for a long period of issues and problems, and then that we respond to those issues and problems then. And so how do we do that? How are we creative? How do we think outside the box? And then that enables us to then make sure that we're filtering information back to, I guess, stakeholders and third sector organisations. So we're together collectively doing a tailored approach, making sure that we keep the heart, the experience of those women, the concerns of those women at the core of what we're doing. And I also believe that there's research, and research is really important. Because sadly, a lot of stakeholders, even though that we're using lots of lived experience because there isn't enough data out there, it's almost a justification sometimes to say, well, actually, we haven't seen this. And a clear example of one of our colleagues giving that actually, the census was done and the data was done, before, and actually our community are constantly changing. And so we're evolving and changing, and the needs and challenges are also evolving and changes. So how do we do that? But I ultimately think that we need to reflect in whether it's those supervision sessions, whether it's those personal developments, whether it's staff meetings, we need to constantly reflect to make sure that we are able to be in sync with our community, that we're able to respond, and we don't wait for things to become from bad to worse. Happy to take any questions, and that's our contact details for anyone who wants to reach out. Thank you.
Thanks so much, Safia. And it's fantastic to hear some of those particular insights that you've been sharing and that lived experience. Thanks very much for sharing with us today. I'll give everyone a moment we don't have any questions in the chat currently. But we do have a hand up. Kat, did you have a question?
I did. I was just listening in awe of that presentation. So I feel that it's incredible. And as I put in the chat, I think these are absolutely the kind of brave conversations that should be happening. Out of interest, because so much of this is about trust and relationships and people being open to sort of examining perhaps their own internal prejudices, that that's a really hard thing to do, right? How have you, your service and the communities that you're supported, how is this sort of the idea of supporting this additional input and being able to present the real lived experience of the community to the local midwifery team? How's that sort of been received by the local midwifery team? Have you sort of encountered any sort of challenges, and if you have, how have you worked through that?
I think for us as a borough, there was a lot of growing, a lot of open and frank discussions, all the way from, I guess, our mayor to senior directors, the CEO of the council, for example. And that enabled us to do the race commission. And actually, the race commission was really powerful. So I was one of the actual commissioners on that. And that enabled us to question everything. And I think at COVID, we saw people dying because they were black and brown and we didn't understand. And so I think those open discussions borough-wide, and we have what's called Tower Hamlets Together, which I guess the CEO of the local hospital, the CEO of ELF, the CEO of the council, the mayor, all those key people sit around the table, and they, I guess, supported this commission, and then they fed it back to, I guess, their departments and organisation. I think for me, it really started off, and we had the Somali Task and Finish group that was a side part of that again enabled us to focus on the Somali community. I think there will always be elements of people going on self-defense, and that's because people are doing really good. There are fantastic services out there, but I think the questions that we need to ask ourselves is that service might be fantastic, but is it fantastic for everybody? Is it accessible for everybody? Does it reflect everybody's needs? And so I think those discussions, and it was also really horrible to see teachers talk, for example, that came, because we had lots of witness statements that came into those commission. And actually some of them were teachers that did not feel comfortable to show their faces, because what they were talking about is real experiences, lived experiences of patients that had to turn their cameras off because they didn't want to be seen or understood differently. And I think as a borough, I think we're definitely in a better place than some of the discussions that were happening 5 years ago. But also there's genuine, because I went into our local hospital and I gave a training to a staff meeting, just as, feeding back and telling them who the community, because a lot of them don't know. For example, never say a Somalian, there's no such thing as Somali, and saying Somali is the ethnicity. So basic stuff like that. And I can honestly say to you, people want to learn, but they were never given the opportunity. They were never given the right, I guess, induction into the borough. It was, you know how to do the midwifery, you know how to do this, and get on with it. So I think now we're starting to realise actually there's a stage before where you need to understand the community. So then you're equipped to be able to respond to the community better. And so I think there is a discussion there. And whenever I go into a training, I always say it's not about judging. It's not about holding you to account. It's about saying, how do we move forward? Because we've seen some really tragic situations locally where people and nationally where, people died as a result of not being able to access key services. And so I think we're at a point where we're saying, actually, let's move forward. Let's no blame, no consequences, no complaints from a stakeholder to a third sector organisation to a stakeholder. How can we learn and how can we move on? So I think that mindset really helps, Kate, in enabling people to be vulnerable, to ask questions, to not be seen as racist, for example, but seen as, actually, I don't know and I want to learn.
It's very gracious, and thank you. That's a really comprehensive response.
Thanks, Kat. Do others put your hand up or put any questions you have in the chat. While we're waiting, Safi, if you don't mind, I had a question as well that I wanted to ask. And, having worked with you over a number of years in Tower Hamlets myself, what's been really interesting over the past couple of decades, really, is in an area like Tower Hamlets, where there's a large Bangladeshi population. And so working with the Somali population, the Somali communities being, a minority among minority groups, I think in no small part your organisation has been really sort of fundamental in ensuring that there is a culturally responsive approach to many communities. I wondered whether you could share anything of your experience, but particularly what you think is really important for any area to consider around the range of communities in a particular area.
No, Abby, that's such a good question. My internet's playing up, so I do apologise if there's any issues, and I hope you can hear me all. I think that's such a valid question, Abby, because what happened, and actually happening in many boroughs and even in our own borough, is sometimes stakeholders invest in, I guess, from diversity and representation of the community, they invest and recruit a member of staff that's brown. And that member of staff that's brown, I guess from their perspective, we have a diverse force. And that's where I guess the issue that many communities that are smaller communities, and actually the Somali community is in a small community, but it's not the largest community because, as you stated, the Bangladeshi community is. So services have ended up being invested in to represent and reflect, I guess, a brown person. And it's interesting when I go in, I'm like, actually the Somali community is complaining, what's your representation? Like, 20% of our workforce is ethnic minority. And you're like, okay, let's unpick that. What languages do they speak? What does that look like? And then you're like, well, okay, you don't have, in fact, what's so sad, sometimes they don't even have Bengali speakers, and that's even more worrying. And so I think it's about, from the Race Commission to the Somali Task Force to those open and frank discussions, it's them realising actually you need to make sure that you reflect the local community, not just that you have a diverse workforce, because that's a tick box. And it was wonderful to see, I guess, those senior people in that platform pledging and agreeing to actually, we're going to go back and say who is, forget just the 20% is diverse, but actually who do they reflect? And it's only when you do that then you realise that actually you're not reflective of the community. And actually that's why some communities are finding it really hard to access services. And I think it's so important to say that actually some of the issues that we're looking at as a borough now is life expectancy. Some of the data that have come out, actually, if you're brown and black, you're less likely to have a long life or you have underlying health issue. Again, it goes back to the simple question that actually your amazing service, and these are really amazing services that we've invested in years and money and campaigns in, was not accessible to those communities. So when you do a diabetes campaign locally, if it's not done in those different communities, or if you're talking about maternity rights and so on, and if it's not done in those communities and you don't have something as simple as a face that looks like them that brings their attention, then you're not reflective of that. So I think it's about just unpicking those data a little bit more and actually then communicating with your community and asking them actually what are we doing really well and what are we not doing so well. And that's for us definitely one of the projects that I absolutely love, Women's Inclusive Team. I love all of them, but this one enabled us to have the tools to do, without KPIs, by the way, which doesn't really happen with third sector organisations, where we're told to actually look at an issue of why Somali women aren't accessing GP and allowing the women to forge, be flexible, identify, say what they want. And some of the fruits that have come out from that is GPs, specifically there's 2 GPs that we did the pilot project, are ready, able and willing to support the Somali community because they didn't know the needs of the Somali community. Now that they do, and some 3 people have found employment within GP services, which means actually, and that wasn't even our KPI plan, it was just naturally and organically it happened because colleagues heard the problem and they wanted to solve the problem.
Thanks, Safia. That's some fantastic examples to hear as well. And it's, yes, an amazing work that you're doing locally. Thanks so much. If we don't have any further questions at this point, I'll hand back to Celeste now. And I have to send my apologies because unfortunately I have a clash this afternoon, so I need to leave for another meeting. But I'll be listening to the recording with great interest. Thanks very much for having me along today.
Thank you so much, Abby, and thank you, Safia. Such an important point around unpicking data that I know a lot of people on the call are working on as well. So thank you so much for that powerful presentation. I will move us on to our next presentation. So I'm delighted to introduce Anne from Foundation Years Trust and Gemma from Koala Northwest.
Hi all, thank you. I'm just going to share my screen to see if you can see this. I'm hoping you can.
You've got some good news. Yeah, I'm going to say that.
Just let me know when you see.
Yeah, can see your screen now.
Okay, brilliant. Okay, so hello everybody. I'm Anne Parker and I'm from the Foundation Years Trust, and my colleague Gemma will be contributing as well. She works for Koala Northwest, and we're two two voluntary organisations who are both based on Wirral. We're a Foundation Years Trust. We are a tiny organisation. There's only a small handful of us, and we only really focus on one area, which is children's learning from their parents. And Koala does loads of lovely stuff, working across Wirral and Cheshire West as well now, on lots of different kinds of things. But we work together on the 1001 Days project across the Wirral. And so we're here to kind of tell you a little bit about what we've kind of found, and some of the benefits. Sorry about the Scouse accent. Hope you can all understand me. Okay, so just to kind of remind people about what home learning is about. So home learning is about what parents do with their children at home, and why that makes a difference. So this is just some of the evidence that we've had in the last kind of 10-20 years. There is actually quite a lot of evidence. We actually are awash with evidence around the importance of parents' role, and yet it doesn't really seem to be anybody's responsibility or priority to kind of support that, in terms of helping parents know what the right thing to do. There's lots of kind of helpful advice online, but you know, it's knowing really what to unpick and what to do. And we still kind of see advice around things like you know, letting baby cry out, not picking them up, feeding them in a particular way. So it's really difficult for parents, particularly young parents, new parents, to know just really what to do. And so we at Foundation Years Trust, and certainly Koala, and I know children's centres do a lot of work around this as well, but it's kind of unpicking that, isn't it? So just to kind of highlight that bit at the bottom, that's the most newest bit of information there, from Morgan, that came out last year, is about mum socialisation. So what that's kind of talking about is, we know that poor mental health, and particularly maternal mental health, can be a real barrier to parents in terms of how they respond to their child. So if their kind of responses are more dampened, if they're not as positive in their responses to their child, then we know that can actually have an impact on children's learning. But actually what this shows is that this can be worked on. Parents can actually be supported even in that kind of depressive state, that we can be supporting them to be more positive with their child. And actually it's that makes the difference with children in terms of their likelihood of having poor mental health themselves later on, and also their learning ability as well. So that's kind of a little bit of a positive, really, that we can support parents to be more positive with their children, and actually that will make a difference. And when we're talking about home learning, we're talking about very simple tasks. We're talking about singing songs and rhymes. We're talking about sharing books and stories. We're talking about using everyday activities to support to interaction. So, you know, things like nappy changes, you know, face to face, giving positive interaction with the child, from in utero, really. You can be, you know, can support that learning. So it's a positive picture, but what I'd say is not so many people are focusing on this, and I think the work that we're doing on the Wirral, between us and Koala, we know it's kind of made a huge difference to families. So post lockdowns, what we found is so speech and language, that's been kind of widely reported in various reports, but we certainly saw that across Wirral as well. So social communication and vocabulary, certainly that, you know, there's been a delay there. Personal, social, emotional development, children have been very wary. Children have maybe, we've seen what is referred to as temper tantrums, perhaps, or poor behaviour responses, and it's about children being overwhelmed and that, you know, not being able to self-regulate. Physical development's been a real hitch as well, because obviously children have had fewer opportunities to develop those gross and fine motor skills. You know, things like just basic things like going to the park and climbing, because, you know, there was a period, wasn't there, where you know, even playgrounds were sealed off. You couldn't go and climb, you couldn't get onto trees and all that kind of stuff. And we found that parents were very wary about keeping distance as well. Didn't want to touch resources, kind of keeping their children away, even when, you know, they kind of came back to groups and so on. parents were very unaware after they came out of lockdown of what a normal behaviour was, so if a child would be kind of maybe playing up a little bit, they didn't know that actually was just normal behaviour, because they hadn't had those opportunities to be in groups and to be sitting with other parents and thinking about, seeing other children behave in particular ways. So it's been a real kind of difficult period, I think, for parents, particularly of new children, new parents, because you haven't had that kind of socialisation with other parents. So what we've offered actually between the two organisations, and I'd have to say this is kind of the key to what we've done really, we've got some, across the two organisations, we've got extremely highly qualified and highly skilled teams. We've been supported by good leadership and by good systems across the two organisations. We worked really hard to develop that partnership approach, to understand each other's organisations really, to understand the individual strengths of some of the staff and the volunteers within the two sets of teams. We've got some good systems of communication. I'm not saying some of that's been easy to develop, by the way, but over the last kind of 2 years, we've really worked hard to develop that. We've been able to develop a wraparound support, so using locality meetings to identify particular families and think about how we can support both across our organisations and linking in with the children's centres, and thinking about how we can support families to access health visiting support and all those kind of different elements of provision across the Wirral. And then we've managed to have quite an innovative system in Wirral through this programme around having consent. Sorry, my phone's going off. Around having consent to from parents to share their information, and I think getting that at the beginning of the project as parents have registered has been really helpful, because it means you don't then have to go back to the parent and say, can I have a chat about you with a different colleague? And if we've got that from the start, it means we can actually just kind of pick up the phone and have that conversation across the different agencies and have that wraparound support. So that's been extremely helpful really for the project. So some practical things really we've been able to do. So when we particularly had opened up our groups again, they were able to have family spots, so that parents can stay with their children in maintain distance, just reassuring parents really. We were being consistent in giving messaging around what is normal behaviour, so that parents don't feel like, oh, my child's crying, I can't come to a group, or feeling that kind of overwhelm. So I want helping parents to understand that actually, it's absolutely fine. You don't need to worry about those kind of things. Having sensitivity and understanding about using those opportunities to talk about what is concerning families. And being careful about what we talk about in groups, mainly focusing on things like personal, social, emotional development, talking about communication language, how they can help, giving parents lots of hints about physical development and also that outdoor opportunity as well. There's lots of opportunities there for parents and families to use the outdoor space as well. So I'm going to talk a little bit now specifically about Foundation Years Trust, and especially in terms of, we offer lots of different services, but specifically around this kind of 1001 days period, we've got 10 groups of early explorers, and they are based in the 5 most deprived wards across Wirral. So they're open access. Although we focus on those deprived wards, we actually don't tell parents that they can't come, because we wanted to remove that stigma as a whole. We didn't want parents to feel, well, I can't go there, or I have to go there because actually that I live in this ward. We wanted to kind of remove that stigma. We use the People Learning Together programme because that's based on ORIM, and that's very much an asset-based programme. So it's very much about finding what parents already do and encouraging them to do more of it, pointing it out to them, because actually parents sometimes don't realise that that some of the stuff that they're doing is absolutely amazing. Once you point that out to them, they're more likely to do some more of it. We often have a topic. We have very the kind of resources we have are things that parents might find at home. So what we're doing is demonstrating that parents don't need to have expensive resources, that they can have kind of a look around their kitchen cupboards and see what else they've got around the home. And and it's very much about them being the asset for their child and what they can do to support their child's learning. And then we have Story Explorers, which is in conjunction with the Dolly Parton Imagination Library, which we have here in Wirral. So anybody who's registered for a Dolly Parton can have 3 sessions of a volunteer coming into their home, and it's a very much a structured kind of programme where the volunteers will go in with set resources and set activities to do over those 3 sessions, but very much about sharing, book sharing and songs and rhymes and all those literacy based activities, but then trying to support parents perhaps into a group and into some other kind of activities around the community that would benefit their socialisation, their child's socialisation as well. So that's kind of what Foundation Years Trust are doing. I'm going to hand over to Gemma, who's going to just talk a little bit about Koala services.
Hi, can you hear me?
Yeah.
Hi, sorry, I've had some issues with my internet during that, and so I can't say anyone and I can't see the slides.
Okay.
I apologise, very typical. Thank you, Anne. So yeah, I'm Gemma Dodd and I'm the Early Learning Coordinator for Koala North West. So I'm just going to speak to you a bit about some of the services that Koala North West have offered to families through the 1001 Day project, and the services we have offered have all sort of had a focus on getting parents to sort of understand sort of how important and how valuable their role is, and it's something that a lot of parents don't understand or realise that their role is so important, making them realise that they are the children's first teacher. So as a part of the 1001 Day project, I've delivered stay and play sessions for children under 3 years old, and these have sort of helped help some of the challenges that parents have faced with regarding, speech and language, getting children to socialise. We've sort of focused on that, doing lots of activities around building language skills, getting children to sort of, when they were first coming to groups, they weren't interacting, so encouraging them to interact, supporting parents to get their children to interact. So that's what we've sort of focused on. And most recently, we started a dads only stay and play at the weekend. We were getting a lot of feedback that from dads in the local area that they wanted to be a part of their babies' early learning, and they felt like they were missing out because everything was offered during the week, or a lot of stuff was aimed at mums through like the word and the advertising. So this is at the weekend, so it's accessible for dads. And so the feedback from this group has been absolutely amazing. They absolutely loved it. Dads came with their babies. They met other dads. They talked about concerns they had about being a dad. They met with our male volunteers. And they felt like they were part of their baby's development and learning and that time, and that made them feel valued and vital in their baby's life. So this is something that we are continuing. We also delivered the Baby Incredible Years programme, which is a 9-week group that helps parents learn sort of how to make their babies feel safe, loved, secure, promote their physical and language development. This group format fosters peer support network and shared learning through video clips of real life situations and lots of discussions about this. This is the discussions we have are all around the weekly topics, and the feedback that we've got from parents is that they enjoyed talking about their concerns and their worries, and it wasn't a case of some groups can be like a bit of a competition. Well, my child's walking, my child was crawling by that age, and they felt like they could talk about those concerns with a trained early years practitioner. So they were getting vital knowledge and information from ourselves, also from the video clips. but also that peer support, knowing that they weren't alone in those concerns. They all felt the same, especially after lockdown, about meeting other parents. Did they want their baby? Could someone else touch their baby? They didn't want someone else to touch their baby. Those parents who, when we talk about, for example, reading babies' cues, there's a video of a parent struggling, and parents like, oh my God, I struggle. I thought it was baby and a bad mom. I can't read my baby's cues. I'm still learning. I'm struggling. So it's taken that stigma away that we as parents automatically should know, but it's not. It's a learning process, and it's empowering parents that they're not on their own, and it is learning. We learn about our babies. And we play a vital role in making them feel safe and secure and building their brain. So they really enjoyed that, and that is a very, very crucial part of what we do in that group. And a lot of people, parents in that group, have gone on and been a support network for each other. So they've set up WhatsApp groups, they meet outside the group, and they're there for each other. And that when the groups ended, they've continued to support each other, which is absolutely great. A massive part of my role is to deliver home learning support at home. Now, this is absolutely vital because not all parents can get out and access groups or other services in the community, and this could be due to confidence. It could be due to mental health, anxiety, depression. They might not have the transport facilities, so they want to, but they don't have a car to get to these faraway places, or they don't have the finances to get on a bus to get in these places if they're not in walking distance. So I go to their homes where they feel safe and they feel secure, and I build those relationships with the families, with the children, and so I do a lot of what the groups do, but I do it in their home. So I could go in and do sort of little mini little sessions with them, like story sessions, singing. I have lots of resources, little bags that I go in and I take them in with me and show them, and the very simple resources. So it could be homemade sensory bottles, homemade musical instruments, pots and pans and spoons, and it's modeling how to use those resources, it's modeling how to play, and it's empowering parents to do it for themselves. And then when I've gone, they can then make those musical instruments, they can get the pots and pans, they can sing those songs, they can read with their children, building their confidence, again making them realize they're the first teacher, okay? Making them understand how important their role is, and not only that, it's also helping them with any barriers that sort of stopping them from sort of do those interactions or focusing on the children's learning. And it could be something like they're having finance difficulties at that moment, so it could be signposting them to other services in the community that can support them with that. It could be that they have no food at the moment, so getting a food parcel into the home to support food. It's all a very tailored approach. So I am led by the family, I am led by the needs. So it could be a case of, right, next week we're going to look at, maybe books, but if I go there the following week and the parents had some bad news or they're having a really down day, that might go out the window, and I might just be a listening ear for the day. And letting that get off mum's chest, or listen to any concerns that they have about their children and giving them reassurance, or finding that information out, or any knowledge about child development, and sort of settling those concerns as well. So like I said, it's all very tailored around the family. And I also support families to access other services in the community. So for example, you know, if I have working with a family who has extreme anxiety, I want to go to groups, because we all, you know, it's important, you know, for, you know, parents to sort of have that socialisation, but also for the children as well. But the too anxious to go on their own, you know, I you know, can start going with them, and then sort of pull back as they get confident to do that. And as a result of my role and the 1001 days, I work in partnership with a lot of the services to sort of help that. I work a lot with the Foundation Years Trust, and take a lot of my families to their groups. I do have a case study that I'll go into further detail about that. So I think I've covered everything that sort of Koala does to sort of help with the home learning.
Gemma, do you want to go over this the visual case study? I've just got that on the
Sorry,
screen.
sorry, I can't see it on my screen. Is that up
Okay.
now?
Yeah.
Okay, fabulous. So this is a case study of a family that I worked with in the home, and of myself and the staff at Foundation Years Trust, working in partnership to support this family. So this family was referred to me from a family nurse practitioner, and this was a young mum who had 3 children under 3. Her first child was born before lockdown. She came pregnant during lockdown. So during the first lockdown, she had a child who was under 1, and she was pregnant. And as I went into the home, she'd just given birth to her third child. There was concerns about the older 2 children's development, especially the middle child, and obviously was there going to be a concern around the new baby's development, because obviously mum had a hands full with 3 children, and obviously had lockdown on top of that, so she's feeling very isolated in this. She hadn't seen much of her family. She was having relationship difficulties with her partner at the time. So I sort of went into the home and I formed those relationships with mum, with the children, and again modelled how to play, how to interact. You know, it's parents sort of think that because they're a parent, they should automatically know how to play with the children. It can be very difficult, and it's not always an easy task. So it was just modelling, supporting parents through that. So mum didn't feel confident, so I was just building her confidence, and just even saying things like to mum, it's okay, you know, we don't all know, we all have to learn, it can be difficult. Did a few little sessions, you know, made resources with us, and made treasure baskets out of stuff at home, made little sensory bottles. We did singing. She didn't know many songs, so I taught her songs, got some books, and then we sort of discussed, during that she split up with a partner, so I offered lots of emotional support in that time, and during that, you know, I got her food parcels and referred her to other services that she needed. So she needed some help with debt, some money management, so we did some referrals there to put that support in place. But also we talked about, because she felt isolated, is sort of building that peer support for her, which she really, really wanted. So that's when I got, because of the 1001 days and the information sharing that Anne talked about earlier, I got in touch with the staff from Foundation Years Trust and explained that I had this mum who was very isolated, very anxious. She was young, she had 3 children under 3, and that we really wanted to get her into her local group, which was literally only down the road from her. So the staff from Foundation Years Trust gave mum a call, introduced themselves. I went to mum's house, I helped mum get all the children ready, took her to the group, and stayed with her. And then slowly, as I backed off, so next time I met her there at the group, next time I didn't go in, I waited outside, and then the staff from a Foundation Years Trust as I pulled away, they got involved with mum at the group and supported her at the group. I would call her during the week saying, you know, it'd be nice to see you at group, hope you're coming. So, and then we kept in touch with how mum was getting on. So mum continued to attend the Foundation Years Trust group by herself, and then eventually the support stopped from Koala because mum was doing really well. She felt really confident. The children's development was improving, speech and language was improving with the middle one. The young baby was developing well, reaching all her milestones. And then I have spoken to mum since, and she started to attend other groups on her own at the children's centre, other community centres. She also got herself on an apprenticeship at a nursery, so the children attended the nursery that she was at, and she's doing really well in this apprenticeship. So it's really, you know, a good success story that, you know, we are all very pleased with, that we work together to support this family.
Thanks, Gemma.
Yeah.
Okay, so just on the screen now, we've just got some kind of quotes from parents. I just kind of want to touch on measurement, really. I know Gemma's kind of talked about a virtual, you know, a visual case study there, and we use a lot of case studies, a lot of stories, but we also have kind of measures as well. So one of our measures is actually using the EYFS, and we know that families who come to our groups, actually the children progress 2 steps further than those children whose parents don't come to the group. So we do know that children's learning is really benefiting from them coming to the groups and getting involved in our joint services. But that, you know, it's obviously about kind of how they're finding it as well, and that's also a measure. So we collect lots of information, lots of quotes like this, but I'm guessing you'll kind of get the measure really of what we're about. So both Koala and Foundation Years Trust are about relationships, really, and about connections, and about attachments, and we're supporting those relationships and attachments within the family. And I think some of these quotes really kind of show that. And here's just a couple more. As you can see, some of the parents are really kind of scared and a bit worried about coming to groups, but actually once they come or accessing the services, once they kind of get to know the staff, they're really kind of drawn in, and they really enjoy it, and they get lots from it. Okay, so just to kind of finish up, really, I'm thinking about the challenges, because although we're kind of moving on from lockdowns, and family life is kind of getting a little bit more normal, isn't it? I think we are, both us and Koala, are still seeing children who are struggling with areas of their development and their learning. We're still finding families who are struggling with speech and language, children with physical development, because they've not had those opportunities, or they've had fewer opportunities. I think we've still got families, really, parents in particular, who are nervous about parenting, about letting their children do normal things like climbing in trees and things like that. And so we kind of need to still do some work around that. But of course, now we've also got the cost of living crisis that's impacting on mental well-being, and again about whether parents are willing and able to provide those wider opportunities for learning and development for their children. And of course, we've got both us and Koala are both small charities, and we're finding it now even more difficult for fundraising and to maintain these services. And I think it's you know, it's a bit of a negative to end on, really, but I think we need to kind of to state it, really, that a lot of the funders are quite rightly directing their funds now onto kind of more crisis kind of support, which is brilliant, and you know, obviously needed, but clearly things like home learning is still a crucial issue. Supporting those younger families and helping attachments and supporting those interactions is obviously going to save a lot of money and a lot of, you know, kind of other services in the future. So I think I'll just end on that, if that's okay. I can't see anyone, by the way.
Thank you so much, Anne and Gemma. Really amazing presentation. There was a question in the chat that's very kindly been answered by Nikki, but we are running slightly over. So what I'm going to suggest is if we move on to the next presentation, and then we'll join up the Q&A. So if anyone has any further questions for Anne and Gemma, please pop those in the chat, and we'll join them up with the next presentation's Q&A as well. So thank you again, and I'm really pleased to hand over to Amy and Laura from Lacala. Thank you.
Thanks, Celeste. Afternoon, everybody.
Hi.
Saving the best till last. So hopefully we'll keep it as succinct as we can. So just before, I wanted to share the presentation that to talk about our approach with what we've done and what we're really excited to share. I'll just introduce myself. So my name's Amy Rochshade. I'm a business manager for Lacala Health and Wellbeing.
And I'm Laura Foster. I'm the Community Project Coordinator on a secondment to the Starting Well initiative. Usually I'm a child development practitioner.
Brilliant. So just bear with me one moment while we share our screen and we can talk through. So what we're going to focus on today is obviously with the money that we've been able to get from the Starting Well Fund, one of the things that we want to focus on, which is about addressing speech and language communication issues, which follows on nicely from what Koala were just kind of sharing. So because obviously we've struggled today to keep it really succinct because we're really excited about the work that we've undertaken as our organisation with the Starting Well. But what we want to just give you a bit of background is the approach that we've taken to this project.
So we've had a kind of a double-headed approach. We've taken some of the money and funded some internal things by increasing access to staff, but we've also used some money to fund external community groups as well. So as part of funding internal things, we've increased the access to our speech and language, our oral hygiene and our infant feeding champions. We didn't have those champion roles before, so we've created those roles and given some existing really well qualified staff some extra hours to take on that champion role. The dental champion role didn't exist at all, so that's been newly created, and we're having a pilot in one particular small area of Kirklees, doing some really targeted interventions with children that are identified at their pre-1 year assessment. Anyone with any sort of dental issues or lack of dental knowledge is referred then on to our oral hygiene champion, our dental champion, for some targeted one-to-one support. They get given a toothbrush pack with toothbrush, toothpaste, a sippy cup, and an information leaflet, and then they get follow-up from Chloe, our champion as well. We've also created the infant feeding community groups as well across North and South Kirklees. Kirklees is really quite a large area, and it's split into two North and South, but it has lots of pockets of deprivation and some pockets of not so deprived areas, but across the whole of Kirklees there are lots of vulnerabilities. So we have concentrated in some areas. We did do some community intelligence to find those areas, but we do provide Starting Well support across the entirety of Kirklees in a holistic way, but concentrated in some more vulnerable areas as well. And we have created those infant feeding community groups in all of those areas, giving public access. Mums and dads both welcome. Anyone within the family welcome to those feeding groups. And we call it a feeding group. So although it is promoting breastfeeding, our main mantra is a fed child is a happy child. So we're there to support any method of feeding, and it's a safe space for mums, dads, family members to come together. So the one thing we have created is our speech, language and communication series of videos, which we'll be showcasing. We'll move on to that one as well. We've also created some videos for dental hygiene, and we've linked with one of our partner agencies for some Home Start school readiness videos as well. So along with Home Start, we have also developed some resources that can be used within the communities. So we've created a booklet, a Managing Minor Illness booklet, which has been given out to every child, every family in Kirklees with a child under 5, I think it is, and also given out antenatal contact. Any contact really, any contact we have with a family, we're promoting these booklets and giving them out as much as possible. They've been really well received, and they are invaluable. About things like when to go to A&E, how to manage diarrhea, how to manage coughs and colds, just really good basic information on what to do when it's appropriate to call a doctor or to call Lacala. So yeah, really been really well received. we've created a funding group where we've been funding certain community things. So things that people across Kirklees have been coming to us for funding, we've sat on the panel and assessed those applications for funding. It has to meet all the starting well criteria, and they can prove the benefits to those vulnerable communities. We've then funded certain things. So we funded things like one called Loving Hands Outreach Team, which is they give out food bank packs, but it's not just giving out bags of food, it's also coming together for weekly cooking lessons with the recipes for the ingredients in that bag that week. They get ongoing support for 6 to 8 months after the block of cooking lessons. They're all together in a group, they come back together. They had their coffee and chat this morning because their cooking lessons are now finished, but they're still getting the weekly food packs. But today was coffee and chat, so I went along to that this morning and just had some sort of general advice around children's behaviour management with them this morning. It's a really lovely group. So that's one of the things. We funded a stay and play at a local school. We funded a local dance group, for children with special educational needs who have sort of mental health issues, some of them
disabilities such as autism and being non-verbal, so through music they're able to communicate and connect, and it's helped the motor skills, communication, that brain connection, that cognitive.
So we funded those as well, and lots of other things throughout the community. So we've funded ourselves internally to provide extra services, but we've also funded the community via that funding panel as well. And we've also created my role to be that link between the community and Locala as well.
And one of the things I think we're really proud of within Locala is that with this project and the whole ethos of our organisation is we've been completely community led. So what we've done a lot of hard work over certainly the past 18 months to 2 years is to really break down those barriers with our vulnerable communities and allow them to tell us what they want, what they need, how can we better establish relationships to help them have that early intervention and prevention for their children starting well. So as Laura said, what we're here to talk about and just focus on and showcase to you all is, because of the funding that we received, is the speech, language and communication series that we have now. It's in sort of the final stages of being edited. But one of the things that was really important to us when we were looking at creating this speech and language communication series was staying true to the Starting Well ethos. So we wanted to invest in a local media company to help us bring the vision to fruition, really, with what we needed for the speech and language communication series. So the series, what it does is provides education and information to parents regarding communication and language development for their children at key development stages. So the other thing that we've done is they have been developed in partnership with our local speech and language therapy colleagues. So that's from other SALT colleagues from other foundation trusts. So we've got their skills and expertise to make sure that the actual communication series is reflective from a practitioner point of view as well. And so we got feedback from service users we saw on the value of those resources to support them with the development of their baby and toddler. So like we said, one of the things that we did was listen to some community intelligence. Laura's going to talk about the approach in a minute, but what we needed to do was listen to the community. And touching on what Koala said, obviously one of the things that we massively found was that parents had an issue with speech and language and accessing waiting times and obviously all those pressures that accompanies that. So it led us to our consultation process.
So our very initial consultation process highlighted that speech was an issue across Kirklees. We've got huge waiting lists for speech therapy, so we were really hoping to target some early interventions to hopefully cut down those waiting times, or even maybe not even need to be referred in the first place. If they get those early interventions in right and get that those sort of early speech messages across, we can hopefully avoid a referral in future. So a survey was sent out to the whole of Kirklees, to all families with children, and we had received 104 surveys back. So we quite asked the questions: do you think that films offering advice about communicating with babies and young children would be useful for families? We had an overwhelming response of 75% basically said yes, definitely. And how likely is it that you would watch one of these films? Again, a massive 64% said yes, definitely. So the response was clear that the need was there and that it was something that the community would be interested in as developing.
So what we want to show you now is we've got a snippet of the video. So some of these are in the final stages of being edited with the local media company that have filmed the entire speech and language communication series for us, and it's just about antenatal. So what we wanted to do was show you the video. So the approach, how these will be sent out to parents across Kirklees, will be via System 1. So some of you will probably be aware of that, which is our clinical system. So these are going to be sent out to the parents with a short explanation and narrative at the identified timescale relevant to the child's age. Because as we know, when you have a baby or you've got a lot of things going on and you've got a lot of intervention and communication, it's very difficult to absorb and retain the information that you're given at whichever intervention that is. So once these speech and language series are sent out via System 1 on a link, the parents will receive it via text message, and then they can basically watch that as many times as they want. So if they want to go back to refer to it or just look at some tips a week later, they're always going to have that message there. So just bear with me, and I'm going to get the video up for you just in one moment. Make sure I'm sharing sound.
Yeah. Let us know if you can't hear it.
Yeah, please let us know if you can't hear. Include computer sound.
Couldn't share sound. Oh no.
Ooh. There we
Right.
go. There we go. Hopefully you'll be able to hear this. Oh, frozen.
Welcome to the Speech, Language and Communication series. This session is aimed at giving you information and ideas to get your baby's speech and language off to a great start, even before they're born. Hi, I'm Priya. Welcome to Locala's Early Speech, Language and Communication series. The series will offer information and advice on how you can support your child's language development. Please share this with other family members and people who spend time with your child. The most important place that language grows and develops is in the home with you. As parents and carers, you are the best people to nurture language in the home. Throughout the series, we'll give you lots of ideas as to how you can help your child at home in everyday activities. Every child will be at a different stage in their development, so we've included ideas that everybody can use. For children and families that speak more than one language, it's important to talk to your child in the language or languages you feel most confident speaking yourself. Children who speak more than one language babble and say their first words in the same way as children learning one language, but some may do it slightly later. It's important not to confuse this slight delay with language difficulties. Most children quickly catch up. Some children will know more than one language from birth because they hear them at home. However, other children may not learn English until they go to nursery, and that's okay. When they go to nursery or school, they may need to spend a lot of time listening before they give English a go themselves. As with their first language, a child's second language needs to be learnt in everyday experiences and through spending time with others. Children often understand their second language long before they can speak it themselves. Keep encouraging them to use actions and facial expressions while they're learning. When babies begin to hear the world around them, the most important sounds they'll discover are the voices of their parents and the people around them the most. This familiar noise will calm and soothe them and lays the foundation for their social and emotional development, language and speech. Even whilst they're in the womb, a baby can begin to build a bond with the people who love them. From about 16 weeks, babies can hear their mum's voice, and by about 20 weeks, they start to get to know other familiar voices too. Knowing unborn babies can hear you gives you a great opportunity to begin communicating and building a bond with your baby, even before they are born. It may feel like a silly or one-sided conversation, but talking to your baby whilst they're still in the womb helps you to build a lasting bond. What's more, bonding with your bump helps your baby learn. It's easy to do and other people can get involved too. Talking to your bump in the third trimester of pregnancy has been proven to have a calming effect on your baby. Incredible new research also shows that unborn babies can remember what they hear and can be soothed by repeated rhymes. Talking to your bump might even help their early language development. Your unborn baby loves to hear the sound of your voice. It calms them and helps them begin to feel safe and secure when they hear you. It doesn't matter what you say or how you sound, talk about anything to them, what you're doing, how you're feeling, or even what you need from the shops. Sing favourite songs, nursery rhymes, or something you've made up. You sound great to your baby. Read a magazine, a children's book, anything at all. It will give you and your baby the chance to tune into each other, and all the time, your baby will be getting to know familiar and safe voices. Encourage others to get involved. Your baby can get to know people's voices and will be able to recognise them when they're born. Brothers and sisters will also really enjoy talking to the bump and sharing songs and stories with them. If you give some of these ideas a go, you'll be setting your baby up for a great start with their talking. From the moment they're born, children are taking notice of and listening to the language all around them. Talking and understanding of any language does not develop on its own. Why don't you have a go at some of these ideas and share this video with others? You'll be helping your baby get off to a great start with their talking. We hope you found this video useful and enjoy trying out some of these ideas with your baby.
So hopefully you could all hear that. So we just wanted to showcase what we've done with the speech and language series with a focus on that. So as Laura mentioned earlier, we've also filmed one for our dental champions, so we're going to be sending one around oral hygiene, and we've also done a video in collaboration with one of our partners, which is Homestart, regarding school readiness. But regarding the speech and language communication series, we also shared what we'd done with our complete 0 to 19 workforce. So that's all our health visitors, school nurses, child development practitioners, school nursing assistants for their feedback. And they all absolutely loved it. So we're really excited to get the rest of it sort of edited and finalised and then showcased and launched, because obviously it's going to be a great thing, and we're addressing a need, because obviously it's come from listening to our vulnerable communities and breaking down those barriers and us trying to help all about that early intervention and prevention around children starting well in future. So thank you for listening, and we're happy to take any questions.
So got a question there.
What a helpful video. Is video available to anyone to view? Mo, it's still been in the process of being finalised at the moment, but hopefully when we get a launch put together, we're hoping to showcase it across. So once we can do that, we can maybe share that with Celeste once we've got an update, and then she can share with everybody else who's interested.
It was a big discussion that we had, whether we make it just purely available to our Kirklees colleagues and as partner agencies and everyone in Kirklees, or whether we actually make it a saleable item that we sell to other areas. We've had some really long discussions about that, haven't we, as a team?
Yeah.
And we're still not entirely sure which way we're entirely going to go, but I think maybe
yeah, no problem.
So just sending it out to everyone is probably
yeah,
going to
but
be
like I said, we're still we've just got some final tweaks, because obviously we did do that in the summer, and obviously it's not a quick thing, it's taken time, and obviously getting our clinicians out of the clinical diaries and then filming it with the media company, and then there's a lot of editing and making sure it's reflective and then getting clinical feedback. So it's been quite a lengthy process, but because one of the things we're very passionate about is that it's right, and it needs to be right for parents, and that it's informative and it's something that's timeless ultimately, so that we can share this in 5 years time. And obviously things change, but that's ultimately what the aim was as well.
Yeah.
Thank you so much, Amy and Laura, for your presentation, and that video is amazing. As people in the chat are
very
sharing.
proud of it,
yeah, and completely echo that. I'm just looking through questions in the chat for either Amy and Laura or Anne and Gemma. I know there was a question from Mo for Anne and Gemma around if there are any resources from your work that you're able to share.
Sorry, yes. So we actually use the People Learning Together programme, and actually you can get online and kind of find that yourselves. There's loads of kind of lovely resources there on the People Learning Together. But yeah, actually we've got both us and Koala, actually Foundation Years Trust and Koala, both got Facebook pages and Instagram pages, and we've got lots of home learning messages on there that parents can kind of pick up on themselves, and we encourage parents to kind of share their own things as well on there. So yeah.
Great, thank you. And what I'll do for everyone on the call, I'll speak to all the speakers. If there are any links and things to further resources they'd like to share out with everyone, I'll collate that and send it around to everyone who's joined the webinar. Does anyone else have any questions for Alan, Gemma, or Amy and Laura? While people have a think, I'll just, for the purposes of the people watching back on the recording, I'll just read that one from the last presentation that was answered in the chat. So someone had asked how Koala Northwest found their families for home visiting approaches. Do families self-refer, or do other professionals refer/signpost families? And the answer was professionals can introduce families to the support on offer from Koala. There is no formal referral as such. As in the past, we've received huge amounts of referrals from professionals with not much take up in comparison to the numbers referred in. Are there any other questions for our speakers? If anyone wants to raise their hand or post it in the chat. No more questions. Does any of our speakers have any final reflections they'd like to share?
Well, just to add, where if anybody else is attending the Starting Well Learning Day on Thursday, we're going to be talking about our approach as an organisation, obviously in more detail. We just had to pick a snippet, which is hard today. So if there's anybody else that's attending the Fund Learning Day on Thursday, then we'll see you there.
Absolutely, yeah. And for anyone who's not familiar with the Starting Well Fund and the Maternity Consortium's work to share learning, we have done a previous webinar focused on sharing learning from the projects around co-production in maternity and early year support. So again, when we kind of send the follow-up email round, I'll send a link to that. There's also a map of the projects where they're located. Just to flag again to anyone who isn't familiar, the funding is coming to an end in March 2023, but that doesn't mean you can't link up with the projects and make connections and hear about the learning from their work, as well as any kind of further initiatives to kind of continue the Starting Well funded projects through other avenues. So do make use of those maps and contacts if you think it would be helpful for you. And I'm more than happy to kind of make connections with organisations who would like to do so. So I'll put my email into the chat and send it around afterwards as well. It looks like we don't have any more questions, so I will thank all of our speakers. So thank you, Abby, Emily, Faiza, Kat, Safia, Anne, Gemma, Amy and Laura for your presentations. Genuinely, it is so helpful to hear about the learning from your work, all of the amazing things you are doing and the people that you are supporting. Really powerful insights shared. And I guess, you know, one takeaway from me is that we co-hosted this webinar with Barnardo's because there's that crossover with the work that the Maternity Consortium and the Barnardo's Consortium are doing on the Health and Wellbeing Alliance. But I think listening to all the presentations, it's so interesting to kind of see that journey of support and the different organisations that are involved in a family's life, from kind of conception as the child is born, and then as they grow up, and all the kind of antenatal support, postnatal support, speech language support, home learning environment, all of that. And it's really important. So I think sometimes to hear it all together so that we can see what an impact we can have throughout a family and a child's journey. So thank you to all of our speakers. Thank you to all of you who have attended, and really appreciate your time. The webinar recording and slides will be shared following the event. I will kindly ask you to complete this very short evaluation form that I'm posting into the chat. It's just a few questions, and I'll send the link around afterwards as well. Any questions, please do get in touch. But hope you have a great rest of the week. Thank you so much.
Thanks, Celeste. Thanks for pulling it all together. Thank you.
Thank you.
Thank you. Bye.